Part 35, Giving Breaths in Child CPR. Welcome to the lesson on giving breaths in child CPR. In this video, we will discuss the steps of how to give breaths in children. CPR in children. Most children who need CPR have had a breathing problem that caused the heart to beat irregularly or to stop beating altogether. Signs of ineffective breathing. Signs include slow breathing, very shallow or sporadic breathing, and absence of any breaths altogether. Give rescue breaths to children who appear to be struggling to breathe. A good breath will cause the child's chest to rise. Giving breaths. Before actually giving breaths. Step 1. Open the child's airway by putting one hand on their forehead and placing your fingers on the bony part of their chin. Step 2. Gently tilt the head back while lifting. Now you are ready to deliver breaths. Step 3. Hold the child's airway open and pinch the nose shut. Take a deep breath and seal your mouth around the child's mouth. Step 4. Gently exhale into their mouth for 1 second using enough force to cause the chest to rise. Repeat for a second breath. This concludes our lesson on giving breaths in child CPR. Next we will review mass cues in children.